Okay, so good morning to all of my dear viewers. In today's session, we are going to discuss a very important topics of community medicines, and the name of topics is National TB Elimination Program. Okay, so we start this National TB Elimination Program with its history. So the first TB program are launched in India in the year 1962. The first TB program launched in India in the year 1962 with the name of National TB Program. What is the name? National TB Program or the NTP. But the treatment success rate is very low and the death rate is high. Also, most of the patient develops drug resistance TB. Okay, so what happens in the 1962? The first times Indian government launched a TB program with the name of NTP, I mean National Tuberculosis Program. But what are the difficulties faced by the governments after launches this program? The death rate even after launching this National TB program is very high, and also the case rate is very high, and even some of the patient develops multiple drug resistance TB. So basically these are the failure of NTP, I mean National Tuberculosis Program. So what happens? In the 1993 government did some changes and they introduced a DOTS therapy and relaunched with the name of Revised National Control Program. So after the failure of these NTP programs, in 1993 government introduced a DOTS therapy and renamed this NTP as RNTCP, I mean Revised National TB Control Programs. So this DOTS therapy are introduced in this RNTCP program. So what are this DOTS therapy? There are 5 important components of the DOTS therapy. In simple word, we can say that in DOTS therapy, the main purpose is that the TB patient take medicine in the presence of healthcare worker, because some of the patient develops the resistance TB because they not follow the drugs or the medication. So the government ensured that now they introduce DOTS therapy in which it is ensured that now the TB patient take medicine in the presence of healthcare workers. So what are the 5 important components of the DOTS strategy? First is the strong political and administrative will to control the TB. So the first thing is that both governments and the administrative officer, I mean health workers, they having a strong will to eliminate or control the TB. So what are the second things? The second things is the quality diagnosis of the TB case. The first thing is that they are having a strong will to control the TB. The second thing is that they focus on diagnosis of the TB case. Not diagnosis, basically they are the quality diagnosis of the TB case. The third thing is that adequate supply of the medicine. So after the first 2 things, I mean first a strong will to control the TB. The second is for the quality diagnosis. And the third things are include that governments ensure that there is a proper supply of TB medicine to at each PHC level. After the third thing, the fourth thing is obviously on the basis of the name of this strategy given, that is a DOTS therapy, directly observed treatment short courses. So in the four things, it is ensured that the patients swallow the medicine in the presence of healthcare worker. And the 5 things is that systematic monitoring and the accountability. Accountability means responsibility or answering for any issue. So these are the 5 components of the DOTS therapy. What are the 5 components? The first component is that there is the strong will of both government and administrative officer to control the TB progression. The second thing is that it ensures that there is a quality diagnosis of the TB case. And the third thing is the proper medicine supply. There is the proper supply of medicine at the each PHC level. And the fourth thing is that it is ensured that the patient take medicine in the presence of the healthcare worker. And the last thing is that whoever the taken responsibility of this TV program, they having responsibility to answer the any issue which face in between the program. So these are the 5 components of DOTS strategy. So in 2006, a stop TB strategy was announced by WHO, which also adopted by the RNTCP. So after this 1993 RNTCP, in 2006 WHO launched a stop TB strategy. So whatever the goal of this stop TB strategy, they also follow by RNTCP. And in 2020 again government renamed, so now the TB program is known as National TB Elimination Program. So after 1993 again renamed in 2020 with the name of National TB Elimination Programs. And in National TB Elimination Program, their target is to reduce the mortality of TB patient 80%, reduce new case 90%, and having a zero catastrophic expenditure. So target is that reduce the mortality 90%, new case 80%, and having a zero catastrophic expenditure. So how we reduce or how we can fulfill this criteria? For fulfill of this criteria, the key strategy is the newer initiative strategy, in which they include the active surveillance and provider initiated testing. So what done in case of the active surveillance? In active surveillance, one health worker is appointed per 1 lakh slum area population. And what is the work of this health worker? They go door to door of vulnerable population and take the sputum sample and send this sputum sample for the microscopic examination. The second thing is the provider initiated testing. So in provider initiated testing, so what it is strictly say by the government to all the doctors, including both private practitioner and the government doctors. So who when any patient of corona or HIV patients or diabetes patient visit to your clinics, we ask them 4 questions. What are these 4 questions? The first question is that do you have weight loss and weight loss more than 10%, or the chronic cough for more than 2 weeks? The third question is that the night sweating, and the fourth question is what are the fourth question is? What are the fourth question? I forget fourth question. Fourth question is that his blood is present in his sputum. So this fourth question asked by all the patient of HIV, diabetes mellitus, and the corona. And if any question answer come in yes, then take the sputum samples and send for the CB nets. So these are the 2 strategies included under the newer initiative programs. So this all about the National TB Elimination Programs. I hope you can understand the lecture.